Hello, I'm Dr. David Torres, and I'm a clinical psychopharmacologist. I'm here to talk to you about mood stabilizers. Mood stabilizers may work through many different mechanisms of action to modulate nerve cell firing. We all have mood swings. What determines the degree to which we have mood swings depends both on genetic and environmental factors. Our thoughts and behaviors are based on synchronous firing of our nerve cells. The major neurotransmitters that regulate nerve cell firing are glutamate and dopamine, but neuropeptides and hormones regulate neuronal firing as well as other monoamines. The rate at which nerve cells fire depends on many factors and include ion channel number and sensitivity. Ion channels in nerve cell membranes regulate the influx of many ions, but sodium and calcium are the major ions which determine depolarization and therefore the firing of nerve cell action potentials. We can control ion number and sensitivity by several methods. We can use ligand-gated ion channel acting medications which work directly at the level of ion channels, or we can use G-protein linked medications which do not work directly at the level of the ion channel but work slowly to change the transcription of DNA which codes for the proteins that form ion channels. Medications and neuropeptides that work at G-protein link receptors work slower to influence ion channel ion influx through signal cascade. Examples of medications that work rapidly and directly at ion channels are the mood stabilizers Depakote, Tegretol, and Triliptal, which work at voltage-sensitive sodium channels. Lithium itself is a tiny ion. We are not sure how it works, but it does work directly on the signal cascade and affects both glycogen synthetase kinase and the anti-apoptotic protein BCL2. Lithium, like many other medications, increases BDNF, or brain-derived neurotrophic growth factor, and is thought to be neuroprotective. Examples of medications that work at G-protein-linked receptors include the atypical antipsychotics. The atypical antipsychotics affect the creation or destruction of ion channels within the course of minutes to days to weeks, or even throughout the life of a neuron by influencing DNA transcription of proteins which form ion channels. Molds, bacteria, and plants have G-protein linked receptors coupled to cyclic AMP or phosphatidylinositol, and neither increase or decrease this heterocyclic nucleotide. While D1 and D5 receptors tend to increase cyclic AMP, D2 through D4 receptors tend to decrease cyclic AMP. Our brain has different concentrations of receptors located in different regions. Our frontal lobes have very few D2 receptors, and dopamine regulation occurs primarily through the enzyme catecholomethyltransferase, which degrades dopamine. When people in a high-energy mixed manic or manic state, we stabilize mood by blocking dopamine in the subcortical mesolimbic pathway. We can make people zombie-like by blocking dopamine in the mesocortical pathway at a dose which causes greater than 80% occupancy of the D2 receptors or lower. It is therefore important to use just enough of a dopamine blocking agent to quiet down the mesolimbic pathway while maintaining adequate levels of dopamine in the dorsolateral prefrontal cortex to promote good cognition. You can go to my website, shrinkharmony.com, to learn more about these medications, my book, The Art and Theory of Bipolar Disorder Medication Management, and how to attend my neuroscience office lectures on Mondays and Wednesdays, 6 to 7 p.m., and Saturdays, 9 to 10 a.m. Mountain Time. From shrinkharmony.com, I'm Dr. David Torres. We'll see you soon.